The contrast I see is, the model of primary care I was really trained in, which was comprehensive, but it was comprehensive because of the services you as an individual delivered. Team-based care meant you and your MA, your medical assistant who helped room the patient. That was the team that took care of the patient. And that was how primary care functioned by and large until relatively recently. So the benefit of the patient-centered medical home movement is really increasing the comprehensiveness of what you can do and the support that you have at the time of service and away from the time of service. The Marcus Welby model, as much as we may find that romantic, just doesn't work in this day and age. The system is more complex. The patients, many of them are older and sicker. And there's times where you just struggle to do what you need to do to get people what they need. And having both a practice infrastructure of systems, be it electronic, having additional ancillary staff, just gives you additional capabilities to bring to bear.
One of the things that I notice is stuff can happen more quickly. If I have my A1C and I come in for an appointment with Karen or Dr. Ryan, they can access it right away. They have access to a lot of stuff very quickly. My records are all in there. They probably know more about me than they should. We were going on a trip, and on a Thursday night we were leaving. On Wednesday, my wife had some palpitations, sweating, sore under her arms. She was, slurring of speech and stuff. And I thought, oh my gosh, we got a stroke here or something. So we went to Packard Health West at 8 o'clock in the morning. The doctor there, Dr. Robbie, took care of her. He was very kind, gentle, took a lot of time to ask questions and talk to her. She's 82 years old, so got to treat old people nice. And he gave her an EKG, and he said, if you were my mother, I would tell you not to go on this trip unless you had a stress test and saw a cardiologist. So we thought, well, that's the end of this. So he arranges it. By 1:30 we had a stress test. By 3 o'clock we had a meeting with the cardiologist. She was okay, and we went on our trip. So that kind of teamwork and connection with St. Joe Hospital and here was really important.
We've seen our practice incorporate integrated health, which means behavioral or mental health care into our practice. So many of our patients with chronic diseases don't just have one, they have several, and for many, depression, anxiety, and other conditions often prevent them from being able to fully self-manage their chronic conditions, their physical chronic conditions. So being able to have mental health professionals on site, as well as the rest of us in the team that deal with medical management, has really been able to totally care holistically for the patient.
You build this robustness into the clinical model in the office. Really the next step is to, to the level that you need, actually start to move out of the office with it. So now you're moving from, simple routine care, even complicated care in the office, to looking more at how the really complicated folks are doing at home. Everyone assumes it's easy to get into the office. Sometimes people just have trouble either with transportation, getting in and out of their home due to their medical conditions, poor family supports. It's really, to me, that's the next thing to move to.
So I come in for encouragement half the time, just that I'm doing okay. Because sometimes it feels like there's nothing happening really. You're just maintaining. And then I can come in here and get some encouragement along the way. But she knows, when I get in here, she knows who's coming and what my history has been. And I like that.